Good day. I am Dr. Eileen Espina, a family medicine specialist and a public health practitioner. I will be your resource person for Module 11. Module 11 is entitled Disease Surveillance, Contact Tracing, Isolation, and Management. The objective of this module are as follows. For our allied health professionals, to further reinforce concepts about disease and public health surveillance in school health, and to contextualize the role of schools in contact tracing, isolation, and disease management in the control of and in preventing disease outbreaks and epidemics. For non-allied health professionals, to emphasize shared responsibility of disease surveillance across sectors as a core value in public health, and to contextualize the role of the schools in contact tracing in the control of disease outbreaks and epidemics. Public health surveillance is the ongoing systematic collection, analysis, and interpretation of health-related data essential to planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of this data to those responsible for prevention and control. There are four types of public health surveillance. One, passive surveillance, wherein the diseases are reported by healthcare providers to health agencies. Second, active surveillance, wherein health agencies actively contact healthcare providers in different settings to seek reports of reportable diseases. Third, sentinel surveillance. This is a form of reporting of health events by healthcare professionals who are selected to represent an area or a specific reporting group. And lastly, syndromic surveillance, wherein reporting is focused on one or more symptoms rather than a diagnosis. To give you some examples of ongoing public health surveillance in the country, we have health indices, registries, situational reports, and reports of product consumptions. So for example, we have nutritional status of under 5 children. We have the HIV/AIDS Antiretroviral Registry of the Philippines, and we have the COVID-19 situational reports from the DOH, which we check on a daily basis since 2002. Disease surveillance, on the other hand, is a process of monitoring the incidence, prevalence, R naught, and other epidemiologic measures of specific diseases or disease manifestation, the purpose of which is to monitor for progress or trending of disease spread or patterns. Examples of disease surveillance are as follows. For health indicators, informations like how many children under 5 has died from watery diarrhea this year is a form of disease surveillance. This is also known as the case fatality rate. Incidence data. So we would like to know, for example, how many teens have contracted HIV during the COVID-19 pandemic. Lastly, we have administrative data as a form of disease surveillance, which, for example, would include how many test kits for COVID-19 have been used and how many are remaining on stock. What is the importance of disease surveillance in school settings? Schools, as we know, are vulnerable to disease outbreaks for the following reasons. Number one, it is the meeting ground of many people from different home settings with varying immune or vaccination status and varying health behaviors and practices. It is also an area where there is close physical interaction, not only among students, but also among teaching staff and faculty or teachers. And since schools usually operate for more than 4 hours every day, we would expect prolonged exposure and contact between people with the disease and the vulnerable population groups. Disease surveillance, therefore, would allow school authorities to properly plan and programmatically observe and evaluate epidemiologic measures in order to prevent a disease outbreak. How can we prevent disease outbreaks? We prevent outbreaks in schools by implementing standard precautions that would promote safe and clean environments. We should also adhere and observe basic good hygiene practices like hand washing and what we call as the apat dapat, wherein A is for observance of air quality, P for physical distancing, A for always wearing the proper PPEs properly, and T, limiting the time of interaction to as minimum as possible. Another way to prevent school outbreaks is to exclude the sources of infection. In this manner, we need to identify who are the index patients or the possible source of infection, and we need to trace all the people or all the susceptible contacts that have been exposed to them in a process called contact tracing. And lastly, we can prevent school outbreaks through immunization of the susceptible population. And this immunization will have to be based on the recommended child and adult immunization guidelines. So we go back and discuss each of these interventions, specifically focusing on the prevention of school outbreaks through the identification of the infectious source and the identification of close contacts. We need to understand that there has to be a student, a teaching staff, or a faculty member who would be bringing in an infectious agent into the school. And usually, in more times, more often than not, these infection sources are not even aware that they're already harboring the infectious agent. So when they start to manifest signs and symptoms, and they will report to the school clinic, and the school clinic would see a pattern of people having the same signs and symptoms from the same classroom or from the same workplace, and would report it, that is a form of passive surveillance. But if the school would actively seek out and ask the students, the teaching staff, or the faculty to report the presence of symptoms, once they have those manifestations, that is a form of active surveillance. Surveillance could also be event-based or incident-based surveillance. And how do we manage in these patients? We do management by isolation and the application of the appropriate disease management protocols. What do we do then with the close contacts? And why is contact tracing important? If you look at the figure on the right, the index patient is the patient at the center. And all of these people are the people, other people in the school to whom this index patient have come in close contact with. A close contact is someone that is defined as having had a certain level of exposure that would promote, okay, or would make the other person susceptible to the development of disease.